Hey guys, Dr. Gregory Stowe, Doctor of Chiropractic down here in Dallas-Fort Worth area. I'm going to talk to you about how I improved my pelvic pain with regards to sacral rotation, pubic rotation down in the pelvic area. So I'm going to show you how to use SOT blocks, or how I use SOT blocks, and show you a spinal model and show you a picture in a book, explain to you how rotation happens in the pelvis. So right down here, we have a picture of the pelvis. These are called each side of the pelvis. We call these different areas. So this is the ilium, the ischium, and then the pubis. Okay, and these connect to each other. This is the outside of one. That's the inside of the other, but they come together, they connect with the sacrum, the bottom of the spine connecting there, okay? That's the pubis bone, and just so again, so you're clear, this is a side view. This is the front view of the pelvis. Hopefully you recognize it. There's the leg bones, and if we turn these sideways, now we're looking at these pictures, okay? And then the inside of the other one, right there. So what can happen with these pelvic bones is that they pivot almost, well, let's just call it centrally, meaning this could move slightly back, like it will twist on itself. And when it does that, this one goes forward. So if this goes backwards, if the pelvic, the center of rotation is here, if this goes backwards, this goes forward. If this goes backwards, then this goes forward. And if they are doing the opposite, meaning if this one goes backwards, this goes forward, and then this is doing the opposite of that, one is going clockwise, one is going counterclockwise or anti-clockwise, you start to get a lot of pressure on both the pubis symphysis here and on the sacrum here, and all that tissue down in here, what we call the pelvic floor. So again, I talked about this in another video, and go look at my x-ray video as well. If these are twisting, and again, they don't twist very well because there's bolts in them, but if one's going forward, one's going backwards, they're going at the opposite angle. So the way I improved this in myself is we take SOT blocks. These are actually, you can get these on Amazon for about 45 bucks, I believe. SOT blocks, sacral SOT blocks maybe. What I had to do is this one, the one on my right, was shifted posterior, inferior, so it was shifted back on the right. I'm sorry, but the left's going to move too, so let's just not try to look at the left right now. Let's just cover it up with something. We'll cover it up with a book. So this one here is shifted backwards. This one was shifted forward. And since that's happening, since this one shifted forward, you can see the pressure on the table going down there. What I did was I took SOT block and I put it right underneath here to stabilize my sacrum. Remember, I said the right one was going backwards, so I took the other SOT block and I put it here. Now, of course, there's tissue. There's the gluteal tissue here, so it's a little thicker, meaning you might have to push in further on these to stabilize them, or to get the action you want. So probably about halfway, place the block about halfway. Now again, you see the leg sitting all the way out here, and you add that tissue of the leg, you may feel like it's going all the way under. You don't want to feel it on your butt bone though, so don't push it in so hard that you feel it on the butt bone. And then what's happening now is, since these sides are blocked, they're lifted, and then this side can start to fall, and this side can start to fall, and gravity is going to push. Gravity's going to let these settle. Now, concepts of ligament creep say that these things need to be held for upwards to 12 to 15 minutes without moving, so the ligaments can relax. That's ligament creep theories. So to get the ligaments to start changing, you need to hold it for that long in this position. If it's able, adding pressure here and here helps. Adding pressure on this pubis will help drive this forward, and as you're driving this one forward, it's helping it go back into where it was before. Because remember, this went backwards, so I'm lifting this up to drive this right side forward, but then I add a little bit more pressure on the front to drive that there, and then I actually add a little bit of aid to help drive this one backwards, and then I'll actually come back here with a device and I'll aid this one in going slightly forward with a mechanical adjusting tool. So that's SOT blocks. That's how I use SOT blocks to help me with my pelvic pain, and I saw an incredible improvement with doing that. Where in the past, the stretching I was doing was just aggravating it. The deep pigeon stretches were really aggravating it. They at first they were helping, but eventually I would get up afterwards and feel like in much more pain. I was irritating that tissue that was already inflamed. So until the pelvis is put back into a more stable, aligned position, a lot of the stretching is going to be palliative. It's going to maybe help a little bit, but it's not going to fix the problem. And in some cases, it may continue to make the pelvis become more and more rotated, especially if on one side you're stretching more, stretching longer, and on the other side you're not. If you happen to get it right, maybe you'll improve it, but it's a 50-50 shot. So you really need to know which side. Now, if you don't have an x-ray and you don't know how you're rotated, then you could try this on one side, and I would try it for several days, maybe just several weeks to see if it's helping or not. But it would make you worse if you pick the wrong side. So then if you're getting worse, you would know to switch and see how that relates. Potentially, if you do this with enough pressure, and you gotta be careful, meaning like I'll sit inside my truck when I'm driving, and I'll put something on my right side behind that that ilium on the right lower back. If you don't know your anatomy, you won't be able to find this, but I'll have something putting pressure there, and then I'll take a little book and put it underneath my left sit bone. So same thing with the SOT blocks, but I'm doing it in a sitting position while I'm driving, and if you do it right, you may notice like a huge reduction in pain if you're doing it on the correct side. But if you're doing it on the wrong side, you'll probably see an increase in pain. So you got to be very careful. It's important to know. So an X-ray, an A to P X-ray of the pelvis would really show this. Be careful who reads it, because a lot of people are looking for things that are pathological, tumors, fractures, and when they don't see that, then it's said it's normal. So we obviously know that this situation is not normal. Bladder pain, frequency, pain in the urethra, pain in the rectum, pain in the colon, pain in the prostate, pain going down the legs. There's all these signs of pain, so we know it's not normal. But the X-ray says normal, the MRI says normal, the blood test says normal, the urinalysis says normal, but there's something still not normal here. So you need to look at your own X-ray or take it to somebody who can look at it for pelvic rotation. Not all people know how to do that. CBP, chiropractic biophysics, is a great technique that I use to do that. But again, you know, I suffer with this myself, and it took me a while to really get back to figuring out what was going on with me, because I didn't think it was sacral rotation in nature. But I've gotten so much awesome results with doing it after doing other things, after doing dietary changes, after doing pelvic exercises, internal pelvic soft tissue release, staying off certain foods. And with regards to foods, foods can flare you up in that certain foods will stimulate what we call the inflammatory cascade. Certain foods are going to start to create more inflammation, but the problem already exists down there. So foods that are inflammatory stimulators will just cause this problem to flare up. So it's only, I don't think it's necessarily the food for everybody that causes them. Now some people it may be, but food itself in this case is just aiding to increase the inflammation. That inflammation already is there, that problem's already there. So then staying away from inflammatory foods, you may feel that you get better, but that's just because you're not feeding the inflammatory cycle. Hope this helps. Again, Dr. Gregory Stowe, Dr. Chiropractic, Dallas-Fort Worth area, website, Pain in the Pelvis, still under construction, Facebook page, Pain in the Pelvis, and YouTube channel. We'll keep adding stuff to that to help you. I would love to get your comments, your feedback. Send me a message. Let me know how I can help you. If you need any advice, no problem. I would love to help you. Thanks. Have a great day.